So I've had a little bit of a rough week this week, but I am okay. And I think this time I'm going to share with you some of the side effects of proton beam therapy. As with any other treatment, there are a risk of side effects that you could endure on the way. With proton beam therapy, you've got short-term acute side effects and long-term, possibly permanent side effects. Now, not everybody will experience side effects. Some may experience a few, some may experience all of them, some may experience different. But I was given, and I'm going to share with you, a list of short-term and long-term side effects that I may endure having proton beam therapy to the sacrum area. So the short-term acute side effects are as follows: tiredness, reddening, inflammation and irritation of the skin in the irradiated area, significant soreness of the skin, loss of hair in the irradiated area, increased discomfort or mild swelling. This is due to an inflammatory response that may occur during treatment and is usually mild. Diarrhea or bowel cramps, passing urine more frequently, pain on passing urine, vaginal and vulval soreness, pain or burning on swallowing. Now, as I said, not everyone will experience these side effects. Some may experience all of them, some may experience none of them, some may experience some of them. I'm going to be quite open and honest, as I've tried to be all the time. And at the moment, I'm experiencing tiredness, reddening of the skin in the zone they're firing at, and unfortunately some diarrhea as well. So the long-term and possibly permanent side effects are fibrosis of soft tissues, impaired fertility due to the dose to ovaries and uterus, swelling of the limb, thinning of skin, weakening of bone, increased risk of fracture, insufficiency fractures, impaired healing of fractured bone, stiffness of joint, persistent bowel problems such as irregular bowel movements and or risk of rectal bleeding, early menopause due to dose to ovaries, vaginal narrowing, persistent urinary problems such as passing urine more frequently and or bleeding into urine, impairment of function of nerves, but also late radiation-induced malignancy or cancer caused by the radiation, but that is a very low risk. 3 in 1,000 at 10 years and 5 in 1,000 at 15 years. So fortunately, only being 2.5 weeks in, I am not experienced any of the long-term side effects yet. However, if you've seen my videos before, you will know I had ovarian transposition to preserve my hormone function and fertility, which means I shouldn't go into early menopause, and although I'd be able to carry my own children, they've preserved my ovary, they've moved out of the way, so I have more options in when it comes to children in my future. So I know this has been a little bit more of a serious and factual video rather than a bit more positive and fun, showing you what I've been up to when I'm not in the hospital. But as I said, I was going to be open and honest about my journey and share everything with you, and this is part of that I've had to wrap my head around. I'm obviously keeping everything crossed that I don't have any permanent side effects, or at least if I do have any, only a few coming out of this. But if I am left with anything permanent because of proton therapy, then I'm going to face it as I faced everything else, and that is head on and as positive as possible.